ওম असतो मा सद्गमय तमसो मा ज्योतिर्गमय মৃত্যুর্মা অমৃতম গময়। শান্তি শান্তি শান্তি। নমস্কার, শুভ সন্ধ্যা সকলকে। আজ বিবেকানন্দ সায়েন্স সার্কেল দ্বারা আয়োজিত অনুষ্ঠান ডক্টর অরুণ কুমার শর্মা এবং ডক্টর অর্চনা শর্মা স্মারক বক্তৃতা। আপনারা সকলেই অবগত আছেন যে স্বামীজি কেবলমাত্র যে অধ্যাত্ম চর্চায় জোর দিতেন শুধু তাই নয়, তিনি বারংবার বলেছেন যে প্রাচ্য এবং পাশ্চাত্যের সার্থক মেলবন্ধন তখনই সম্ভব যেখানে পাশ্চাত্যের তরফ থেকে আমরা পাব বিজ্ঞান এবং প্রযুক্তি এবং প্রাচ্যের দিক থেকে তার বিনিময়ে আমরা দেব অধ্যাত্ম। স্বামী শিষ্য সংবাদে সেই তার বাঙালির সঙ্গে শরৎচন্দ্র চক্রবর্তীর সঙ্গে তিনি এই আলোচনা তিনি বারংবার করেছেন, অন্যান্য স্থানেও করেছেন। সেই ভাবনা থেকেই আমাদের রামকৃষ্ণ মিশন ইনস্টিটিউট অফ কালচারের উদ্যোগে এই বিবেকানন্দ সায়েন্স সার্কেলে, যেখানে বিজ্ঞান ভিত্তিক এই যে চর্চাগুলি নিয়মিতভাবে হয়ে আসছেন এবং তার সুচারু পরিচালনা করে চলেছেন ডক্টর শ্যামল লাহিড়ী, তিনিও উপস্থিত রয়েছেন এই সভাকক্ষে। এবং আজকে এই বক্তৃতা যিনি প্রদান করবেন ডক্টর সঞ্চিলা তালুকদার, তার আলোচনার বিষয় আনসাং গ্রেট সায়েন্টিস্ট অফ ইন্ডিয়া ডক্টর সুভাষ মুখার্জি। আমরা কম বেশি সকলেই হয়তো তার সম্পর্কে অবগত আছি, আর একটু ভালোভাবে আজকে আমরা তার সম্পর্কে জানব। কিন্তু তার আগে যে দুই মহাপ্রাণের স্মরণে আজকের এই সন্ধ্যা, তাঁদের সম্পর্কে সামান্য কয়েকটি কথা। ডক্টর অরুণ কুমার শর্মা। ডক্টর অরুণ কুমার শর্মা 1924 খ্রিস্টাব্দের 31শে ডিসেম্বর জন্মগ্রহণ করেন। পিতা চারুচন্দ্র ও মাতা শোভাময়ী। তিনি কলকাতা বিশ্ববিদ্যালয়ের উদ্ভিদবিদ্যা বিভাগের প্রধান ছিলেন। 1955 খ্রিস্টাব্দে ডিএসসি হন। স্যার রাসবিহারী ঘোষ প্রফেসর হন 1969 খ্রিস্টাব্দে। অনন্য ব্যক্তিত্ব এবং পাণ্ডিত্যের তিনি অধিকারী ছিলেন। তাঁর অধীনে 60 জন ছাত্রছাত্রী পিএইচডি করেছেন এবং 10 জন ডিএসসি করেন। তাঁরই সুযোগ্য সহধর্মিণী ডক্টর অর্চনা শর্মা। তাঁর প্রতিষ্ঠিত সেন্টার অফ অ্যাডভান্সড স্টাডি ইন সেল অ্যান্ড ক্রোমোজোম রিসার্চ সেন্টার ভারতবর্ষে প্রথম। পদ্মভূষণ সম্মানেও ভূষিত হন। সর্বভারতীয় বিজ্ঞানী হিসেবে বহুমান্য এই মার্গদর্শী বিজ্ঞানী শ্রী অরুণ কুমার শর্মা 6 জুলাই 2017 খ্রিস্টাব্দে প্রয়াত হন। ডক্টর অর্চনা শর্মা। অধ্যাপিকা ডক্টর অর্চনা শর্মার জন্ম হয়েছিল 1932 খ্রিস্টাব্দের 13 ফেব্রুয়ারি মহারাষ্ট্রের পুনে শহরে। প্রাথমিক শিক্ষালাভের পর উচ্চশিক্ষার জন্য কলকাতা বিশ্ববিদ্যালয়ের উদ্ভিদবিদ্যা বিভাগে 1960 খ্রিস্টাব্দে ডিএসসি ডিগ্রি লাভ করেন। তিনি দ্বিতীয় মহিলা যিনি কলকাতা বিশ্ববিদ্যালয় থেকে ডিএসসি লাভ করেন। 1967 খ্রিস্টাব্দে অধ্যাপিকা শর্মা কলকাতা বিশ্ববিদ্যালয়ে অধ্যাপনায় যোগ দেন এবং 80 খ্রিস্টাব্দে তিনি উদ্ভিদবিদ্যা বিভাগের প্রধান নিযুক্ত হন। ভারতের 3টি সায়েন্স একাডেমি তাকে ফেলো নির্বাচন করেন। অধ্যাপিকা অর্চনা শর্মা ইন্ডিয়ান সায়েন্স কংগ্রেস অ্যাসোসিয়েশনের জেনারেল প্রেসিডেন্ট নির্বাচিত হন। কাউন্সিল অফ সায়েন্টিফিক অ্যান্ড ইন্ডাস্ট্রিয়াল রিসার্চে 1976 খ্রিস্টাব্দে তাঁকে প্রখ্যাত শান্তিস্বরূপ ভাটনাগর পুরস্কার প্রদান করেন। 74 খ্রিস্টাব্দে জেসি বোস অ্যাওয়ার্ড এবং 80 খ্রিস্টাব্দে ইউনিভার্সিটি গ্র্যান্ট কমিশন থেকে ন্যাশনাল লেকচারের এবং পরবর্তী সময়ে ফিকি অ্যাওয়ার্ড, বীরবল সাহানি মেডেল ইত্যাদি নানা পুরস্কারে তিনি সম্মানিত হয়েছেন। 1984 খ্রিস্টাব্দে তিনি জাতীয় সম্মান পদ্মভূষণে সম্মানিত হন। এরা দুজনেই অর্থাৎ ডক্টর অরুণ কুমার শর্মা এবং ডক্টর অর্চনা শর্মা নিরভিমান এবং ধর্মানুরাগী ছিলেন। নিঃসন্তান হলেও অগণিত ছাত্রছাত্রীদের কাছে তারা উভয়ই পরম শ্রদ্ধার আসনে প্রতিষ্ঠিত ছিলেন। অধ্যাপিকা শ্রীমতী অর্চনা শর্মা অত্যন্ত ধর্মপরায়ণা ছিলেন। রামকৃষ্ণ মঠ ও মিশনের তদানীন্তন অধ্যক্ষ পরম পূজ্যপাদ শ্রীমৎ স্বামী শঙ্করানন্দজি মহারাজের কাছ থেকে তিনি মন্ত্রদীক্ষা লাভ করেন। ডক্টর অর্চনা শর্মা 14 জানুয়ারি 2008 খ্রিস্টাব্দে রামকৃষ্ণ লোকে যাত্রা করেন। আজ ডক্টর অরুণ কুমার শর্মা এবং ডক্টর অর্চনা শর্মা স্মারক বক্তৃতা প্রদান করবেন ডক্টর সঞ্চিলা তালুকদার। আলোচনার বিষয় আনসাং গ্রেট সায়েন্টিস্ট অফ ইন্ডিয়া ডক্টর সুভাষ মুখার্জি। আমি তাকে মঞ্চে আসবার জন্য অনুরোধ জানাই এবং একই সঙ্গে ডক্টর লাহিড়ীকেও মঞ্চে আসবার জন্য অনুরোধ জানাই। তিনি আমাদের আজকের এই যে অনুষ্ঠান বা এই সভা সেইটিকে এগিয়ে নিয়ে যাবেন বা পরিচালনা করবেন।
Well, our Secretary Maharaj said that he will try to come, but looks like that he cannot do this right now at least. So we'll start our program today, the main program. So today we have a wonderful speaker and very qualified and competent. And so I'll give us very short introductions because there's many things to talk about Dr. Subhash Mukherjee. So I'll just briefly actually say a few things about her. Just one thing I like to mention at the beginning, that they also belong to Ramakrishna family in a sense, because his husband has been initiated by Swami Ranganathananji, I think when he was alive actually. And so I don't know whether she's initiated yet or not, I don't know. But her husband is. So they are part of this Ramakrishna missions in that sense. All of us have a lot of respect for Swami Ranganathanji anyway. And I'll just give very short introductions. Mostly actually in the poster we try to put it in. So some important ones. She has many other things also. But she got her MBBS from Calcutta University, then DNB from New Delhi, then MRCPI from Republic of Ireland, and MRCOG RCOG London, BSCCP colonoscopy or something like that, colposcopy. Sorry about it, because my technical knowledge about the medical terms is not that great. And BSc in Obstetrics from USC, University College of Dublin. Now, she is right now consultant obstetricians and gynecologists, Manipal Mukundapur Hospital, Kolkata. And so these are very briefly her qualifications. She's very qualified, no doubt about it. And so I'm sure that you will enjoy her talk, and I would not take any more time, so we won't wait for the Swamiji right now. If he comes, then actually he will join it. So thank you for all of you to come here, and so I'll invite and Dr. Talukdar to come and give our presentations.
So by this time, everybody knows this is his picture, only in black and white. কারণ 1980s, late 70s I think black and white ছাড়া ছবি ছিল না। So 1 ঘন্টা is totally not a time to discuss about him. And I'm feeling myself very fortunate being a gynecologist and obstetrician to talk about him today. অ্যান্ড আমি কৃতজ্ঞ রামকৃষ্ণ মিশনের কাছে যে আমাকে এই সুযোগ দেওয়া হয়েছে যে ওনার সম্বন্ধে কিছু বলার, যেটা 1 ঘন্টায় কখনোই শেষ হবে না। সো ডক্টর মুখার্জি ওয়াজ বর্ন ইন আ বেঙ্গলি ব্রাহ্মণ ফ্যামিলি on 16 January 1931, Hazaribagh in Bihar, Odisha province, now Jharkhand. And his father was a doctor, was a radiologist. Mother was a homemaker, but both of them influenced him to become a doctor. So then early education was in first division honors from Bowbajar High School in Kolkata, and then intermediate science from Surendranath College. So ডিউরিং 1940s আপনারা হয়তো সব মানে অনেকেই জানেন সেই সময় অনেকেই বিএসসি করতো, তারপরে ডাক্তারিতে ঢুকতো, মানে দেয়ার ওয়াজ অপশন সেই সময়। এখনও অপশন আছে, কিন্তু ম্যাক্সিমাম লোকেরাই আগে এমবিবিএসে ডাইরেক্ট ঢুকে যায় যারা ডাক্তারি পড়বে, বিকজ দ্য সিস্টেম নাও ইজ ডিফারেন্ট দ্যান হোয়াট ইট ওয়াজ ইন দ্য 40s. So Dr. Mukherjee did BSc in Physiology from Calcutta University with honors in 1949, and then in 1955 he did MBBS from Calcutta Medical College, which was then affiliated to University of Calcutta. 1958 Rajabajar Science College campus of University of Calcutta থেকে উনি reproductive physiology obtain করেন পিএইচডিটা আন্ডার ডক্টর সচ্চিদানন্দ ব্যানার্জি। And then he joined as a lecturer, reader, professor from 1967 to 1975 in NRS Medical College. তার আগে উনি বিভিন্ন কলেজে ঘুরে ঘুরে রোটেটিং হিসেবে ফিজিওলজিতে পড়াতে থাকেন। আর 1967-এ উনি সেকেন্ড পিএইচডি পান এডিনবারা, ইউনিভার্সিটি অফ এডিনবারা, again in reproductive endocrinology. So his main interest was to create a new life, and ওনার যারা ছাত্র যারা এখন বহু সিনিয়র আমার চেয়ে, those who are in their early 80s, late 70s, I have spoken with them, and he was a remarkable teacher. So প্রথম উনি পাবলিশ করলেন on 19th October 1978-এ Director of Health Service, Government of West Bengal, ওনার ovarian stimulation protocol, means how to stimulate the ovary, which is one of the female organs, with two kind of hormonal injection. One is human menopausal gonadotropin, another is human chorionic gonadotropin, যেটা ওনার সময় কেউ করেনি. He used to think ahead of the time, and my seniors who were his student, তারা বলেছে the whole room where he used to stay in the quarter, there was just a bed for him to sleep, rest everywhere it's full of books. So that much he was dedicated. Again, these are quite technical things, but আমি জানি না এগুলো বাংলাতে আমার সেরকম নলেজ নেই কি করে বোঝাবো। উসাইট রিট্রিভাল মানে মেয়েদের ওভারিতে ডিম তৈরি হওয়ার আগে উসাইট বলে একটা জিনিস তৈরি হয়, সেটা থেকে তারপর ডিম তৈরি হয়। তো সেটাকে উনি দেখিয়েছেন যে কি করে পেশেন্টকে পুরো পেটের মধ্যে ওটি না করে বার্থ প্যাসেজ দিয়ে গিয়ে সেটাকে রিট্রাইভ করা হয়। তো introduce a pioneering transvaginal technique via colpotomy, which is simpler and more direct than laparoscopy, যেটা ব্রিটিশ টিম তখন করতো, যে পেটের মধ্যে দিয়ে ফুটো করে ওভারি থেকে ডিম রিট্রাইভ করে তারা চেষ্টা করতো টেস্ট টিউব বেবি তৈরি করার। So this was totally his technique which started all over the world. And his working team was Sunit Mukherjee, a cryobiologist, মানে যে এগটাকে কালেক্ট করে ফ্রিজিংয়ে হেল্প করে, gynecologist Dr. Saroj Kanti Bhattacharya, and he became the first person to perform IVF, in vitro fertilization, which resulted in the first test tube baby in India, and that person's name became as Durga, and the original name is Kanupriya Agarwal, who was born on 3rd October 1978. So Kanupriya alias Durga alias Kanupriya was born 67 days after the British physician Patrick Stope and Robert Edward, who delivered the first test tube baby in whole world, and unfortunately both of them got the Nobel laureate, and our Dr. Mukherjee missed it out. So Louis Joy Brown was born on 25th July 1978, and Kanupriya was born on 3rd October 1978. So you can see just missing out by few days, and she was delivered by John Webster in Oldham Hospital. The thing is that both Dr. Mukherjee and Dr. Robert Edward were studying in the same university, doing the same thing. But that was the fate I think God bestowed upon Dr. Mukherjee. I don't know why. So regarding in vitro fertilization a little bit. So it is one of the several techniques available for people who are with fertility problems in having a baby. So ekhane egg is removed from the woman's ovaries and fertilized with sperm in a laboratory. The fertilized egg is called an embryo and then returns to the woman's womb to grow and develop. Now this is not always an easy technique. Even in the current scientific advanced field nowadays, with whatever science has done, still if 100 women go for IVF, only 25 to 30 will take a baby home. It doesn't matter how many gets pregnant. Many people get pregnant through IVF. But carrying out throughout the term till the end and getting a baby, taking a baby at home is the most difficult part. So you can see the difficulties of new inventor, how much difficulty he faced. So during that time, till he was doing research, till he was not that much famous, till he was getting grant from the then West Bengal government. And he was allowed to do different presentations. But as soon as this came into view, so the government of West Bengal has to put forward a doctor, then only the application will be accepted by the government of India. So he was barred from attending any international conferences. His works was barred from getting published in any of the journals, whether Indian or international. And the Bengal government appointed a panel headed by a radiophysicist with a gynecologist, neurophysiologist and physiologist to examine the claims by Dr. Mukherjee that whether they claimed that it was bogus, it was not at all right, it was totally not, because that time in those days, none of the couples who had underwent IVF can come forward and say, I have a baby through IVF, because it was a social taboo that time. Even now, if I deliver any woman who has undergone IVF, at least 50% will tell me, Madam, don't tell to any of my relatives who will come during the delivery that I have conceived this baby through IVF. And also if they have a donor egg, means taking the egg from some younger woman and going for the test tube baby, that way then totally they tell us not to disclose it to anybody. Whether donor egg, donor sperm, only myself, gynecologist know, the IVF specialist know, and the woman and the couple knows. Nobody else knows. Nowadays it's still there, the taboo. So you can imagine in the late 70s when this happened, how much a social taboo it was, that the couple who underwent the IVF had a successful baby. From that, they couldn't come forward and say that, yes, this is only Dr. Mukherjee's effort that we could hear the Ma and Baba voice from our child. So, overwhelmed by mental pressure, insults and defamation, all this was done by the people who had no knowledge in IVF, who were totally, obviously jealous of his extreme invention. So, on June 1981, 18 June, he committed suicide and he wrote, I can't wait every day for a heart attack to kill me. Because to be honest, whether you do, how much brilliant you are, unless you have a government fund, unless you have government backup, it's impossible to get recognized all over the world still now. In our field at least, because most of the doctors who come, most of the people who come from who are learned, who wants to study, they come from a very middle class background or lower middle class. Very few will see that has come from a very high socioeconomic strata and they are doing everything by themselves. They don't need any government fund. So his recognition is attributed to Dr. T.C. Anand Kumar, who is officially in 1997 was declared initially that he was the first person to do a test tube baby in India, because by that time it has been recognized socially very much. The test tube baby is not a social taboo. It's not a taboo for the couple to go for IVF and have a child through it. So he came to India and he reviewed all the notes of Dr. Mukherjee, and he was helped by Dr. Sunit Mukherjee, who was a one-time colleague of Dr. Mukherjee. So Dr. Sunit Mukherjee was the cryobiologist who was involved in the first IVF, which was a successful IVF in India. And he only put forward, and he is the main person who brought recognition to his work. So the Center for Stem Cell Biology and Regenerative Medicine, a newly established state-of-the-art research facility embedded in Adamas University in Kolkata, was set up, and it is also the first research unit in Eastern India dedicated to research on stem cell and regenerative science. Stem cells are the growing cells, the totipotent cells, means it hasn't had been differentiated into whether they become brain cell, eye cell, or become a heart cell. So these cells can be grown into anything, you know. So he played a crucial role in establishing. And obviously, I don't know how many of you have seen this movie. Ek Doctor Ki Maut was directed by Tapan Sinha, was released in 1990. It was mainly on his life. So all recognition he got was posthumously. Then Mrs. Kanupriya Agarwal on her 25th birthday, so it's obviously modern times, he came out publicly and revealed that he is the first test tube baby through Dr. Mukhopadhyay's effort. And his parents, her parents were present at the memorial organized in memory of Dr. Mukherjee. So she spoke in front of the media expressing joy that his achievement has been acknowledged by reputed, and also once the Dictionary of Medical Biology included his name, he has been acclaimed internationally as well. So as a teacher, what I gathered from his students, especially Dr. Siddhartha Chatterjee, who is one of the eminent IVF specialists in Kolkata, he is probably in his late 70s or early 80s. So he told me, I was speaking with him today, and he told me that he was ahead of his time. All the time he was with the books. If one day we say that today we have function, so let's cancel our class, he will come in the function and teach us in such a way that we will forget that we are having a function, because it's so mesmerizing, the way he used to talk, the way he used to give the speech, he used to make the students understand. Because when we are studying medicine, everything is new to us. Not everybody has parents doctors. So like myself, my father is an engineer who is from Jadavpur University. My mother is a homemaker. So I have no kind of idea how the medicine works, because people with medical background as parents, they know a few terms, because it gets discussed in the family. Similarly, so he was telling that, Dr. Siddhartha Chatterjee was telling that the way he will explain not only reproductive endocrinology, he was given a class to discuss how the heart works, how it affects the other parts of our body. So the way he explained it, in spite of being not his actual subject, was excellent. That we forgot that we have a function today, and we were all present in his class. And he was also selfless, like he will be day and night teaching the students. Any student can go to his quarter in NRS Medical College anytime if they want to study with him. So family wise, he had, his wife's name was Namita Mukherjee, and he was bedridden for 12 years and died at the age of 78 due to multiple health issues. So as a couple, they had no children, and Mrs. Mukherjee had to live a lonely life in her last days at a South Kolkata flat where NGOs India Smile supported her, and Dr. Sunit Mukherjee, who was the cryobiologist in Dr. Subhash Mukherjee team in creating Durga or Kanupriya. So he passed away in 2014, but few months before her death, there was a group circulating in our medical field to help out her in terms of financial in financial grounds because she was suffering. She was not working any time in her life. So you can understand, if a husband dies at a very young age and the wife doesn't have any educational background to pursue a career or earn, then what can happen to old age, in old age. So another thing I was told to discuss about Dr. Indira Hinduja, who was a female gynecologist who did the first gamete intrafallopian tube transfer technique, resulting in the birth of India's first GIFT baby on 4th January 1988. So 10 years after Dr. Subhash Mukherjee. But he was the first female doctor who did a newer technique where in women there is a fallopian tube called structure. So where he transferred it directly to the fallopian tube, and it became a successful episode for her, as she is a Padma Shri. So she was credited for developing oocyte donation technique for menopausal and premature ovarian failure patients, especially for women who are going for cancer therapy at very early age in their life. Many women, we say, they can have cancer at the age of 20, in their early 20s, late 20s or early 30s. So he did that, and the first baby born from that technique was on 24th January 1991. So he was Dr. Hinduja, and we as doctors are very much into, because we are female doctors, not only that for biasness or feminism, but we all tell women's well-being is the first priority for the progression of the woman. So the first thing is the diet, to have a healthy diet, not to neglect own self. Because most women, when we have a family, we tend to neglect ourselves and look after the family first. Family is always our priority. Then exercise and sleep, obviously. And nowadays, smoking among women, the newer generation is increasing. So if you have young people at home, try to explain to them that smoking and less sleep and less screen time, no smoking, better sleep and less screen time is mandatory. Not always with the mobile at home is not a very healthy habit. Another thing, regular health check, not to ignore health issues, which was done by Dr. Mukherjee very much during his lecturer post. When he was a lecturer, he used to ignore his health and always used to take classes, always used to be researching his passion. So when you have a problem, you always consult a doctor, and if you don't like the advice of the doctor, you take a second opinion. And I want to discuss something about prevention of cancer, because nowadays infection is decreasing and cancer is increasing. So any idea among the audience now, what is the female cancer which is preventable? Anybody? Yes? Yes, only cervical cancer is preventable. No other cancer has yet been discovered is preventable, because it has an effective screening test. The precancerous to cancer takes about 10 years for most women to develop. So the effective screening test is pap smear with HPV or without HPV every 3 years. Once a woman is sexually active or 25 years of age, whichever earlier. So I request everybody here, whoever you come across in your life, young woman or woman till 65 years of age, always motivate them to go for pap smear, because even if they don't go for any other test, pap smear is a very effective test which can prevent a cervical cancer. It can catch up the precancerous stage at a very early stage, and a woman won't die of cervical cancer. So if it's HPV positive, which is the virus, 99% cases causing cervical cancer, then they need to repeat it every year. And the next thing is HPV vaccine. Nowadays, pediatrician and we gynecologists are motivating women and children to get vaccinated. This vaccine is safe, and so far no side effect or adverse effects has been identified due to this vaccine. The ideal age is 9 to 14, where you need 2 doses, and the woman over 15 years can also get till 26 of age, but it will be 3 doses. Above 26, the vaccine companies advising to take it because it's still in the research phase. Whether it will benefit or not, we will know only after 100 years. So, and there are two types. One is quadrivalent, cheaper one, and one is nanovalent, which is an expensive one. Next is ovarian cancer. It's most of the time late presentation. Another thing, so regular health check is very important. I have picked up first stage ovarian cancer because the woman went for a regular health check. It was given by her company through which she was working. Another thing is endometrial cancer. So endometrium is the lining of the uterus. And we as doctors say that if a woman is having irregular bleeding, has bleeding after they have attained menopause, don't ignore it. It's not normal to take medicine and stop the bleeding. And the rest, female structure, also early stage is possible diagnosis if you don't ignore the symptoms, especially breast and any abdominal cancer which has the origin from the female structure like uterus, tubes and ovaries. Next is menopause. So for 12 months when the period stops, we say it's menopause. It can be diagnosed with a blood test, or the woman can most of the time make by themselves. So healthy diet, weight bearing exercise, yoga and meditation is the key to fight menopause, and seek medical help if severe symptoms. And the last but not the least, mental health. Nowadays you have youngsters at your home. Mental health is becoming a huge problem because mostly it's becoming nuclear family, one child every family. The child is either not at home or going abroad, working in a different city. Elderly parents are staying alone in their home. So mental health is becoming a major issue among the psychiatric population and the counselors. They always say that we see a lot of elderly people who are suffering from mental health issues. So recognize your near and dear ones who are suffering from mental health issues and advise them to seek professional help. And obviously, first of all, economic independence is very important. What I have seen, Dr. Mukherjee, Mrs. Nomita Mukherjee, Dr. Subhash Mukherjee's wife, had a very difficult time in the last few years because there was no money to take care of her health issues. So, economic independence is the priority you should ingrain among your children. And not to stay in an abusive environment because there is always an alternative. It can't be that there is no alternative. So with that, I conclude my talk today. Thank you very much. Any questions?
I'm from the Indian Statistical Institute. Just regarding the recognitions, when Dr. Edwards and his collaborator got the Nobel Prize in 2010. After that,
20s, yeah, late 20s. I think 21 or 20.
2010, I think.
Yes.
I think. So the next year in 2011, Indian Statistical Institute gave this honorary DSc.
DSc to him. Yes. I saw it in his year.
And another is that this Ek Doctor Ki Maut was based on the novel Abhimanyu by Ramapada Chaudhary, which was based
on his life. Yes.
Yes, this Abhimanyu. Just I was reminded of them.
Yes.
And when Ramapada Chaudhary passed away, this was highlighted that he is the author of Abhimanyu, which was based on
his life. Yes. As India missed a Nobel Prize because of the then people who were around him were too jealous of him. That's all, nothing else. He was always 5 years ahead of his time.
More questions?
No. Hello. What is the position now about the medical students or researcher while publishing any interesting topics in international journals, whether they have to take the permission from Government of India or state authorities or like that, and also for attending some international conference, if they need any kind of permission or like that.
For attending international conference, definitely if you are a government employee, you have to have a NOC. There is no other alternative.
Okay.
And if you don't work in a government setup, it is very difficult to get fund to do any kind of research. In private sector, the funding is not that much you can get as in a government sector. That's the main problem. In medicine, I don't know about other specialities, but in medicine, it's very difficult. That's why everyone wants to be affiliated with the ICMR. And then only you can do some research work.
ICMR is a government organization.
Yes. So my husband did in hemato-oncology for 4 years in King George University, Lucknow, and he did lots of publication and newer things. But that he only could do because it was highly funded by the government of India.
In private, it's
very difficult. Very few funding is available.
Okay. And this publication of this...
Publication as well. Nowadays, you don't need any government of India approval. But if government want to jeopardize your publication, they can do very well. They can do to anybody. Whether you are a government employee or non-government employee, they can always come after you and say you are not allowed to publish because of some trivial issues they might bring up in the paper.
Good evening, ma'am.
Good evening.
Ma'am, can you please explain what is cervical cancer? Because I don't know all these medical technicalities. And one more thing you have mentioned earlier before, this was all about, I guess, abusive environment. How can we get prevented from this kind of environment?
So the first thing is cervical cancer. So cervix is the mouth of the uterus, we say, in layman's term. So that part cells is completely different from the rest of the uterus. So the cells are exposed to the outside environment because the birth passage is open to the environment. So the cell changes happen very frequently. All kind of infection first attack that part of the uterus. So that part changes so frequently. So the pap smear, we call it in medical terms, or cervical smear, is an effective test where the pathologist will check the cells that are obtained with a brush from the cervix. And that way they can know whether the cells are normal, precancerous or cancerous. And cervical cancer has various stages, but to reach that cancer, it can take up to 10 years from the precancerous to cancer. So that's why we gynecologists, pediatricians are promoting HPV vaccine, and gynecologists are promoting to do pap smear, because we can be cervical cancer free, at least in India. By 2050, that's our aim, but we don't know how much that will be feasible.
Okay, thank you.
Because the uptake of pap smear is very poor in spite of advising. The next question is abusive environment. It depends on what kind of abuse the woman is facing, whether it's verbal, physical or psychological. The worst kind of is to face the psychological abuse, where you won't have any evidence. Verbal abuse and physical abuse, there is evidence, police can file a case. You can file a case with the police or NGOs and ask for, but psychological abuse, it's very difficult. Only the person who is suffering will know. And if they didn't have much educational qualification, you can't come out of that. That's why different NGOs help out this group of people to come out of it. Mostly women are involved, but men are also equally nowadays getting psychologically abused, if not verbally or physically abused.
Good evening, madam.
Good evening.
That Dr. Subhash Mukherjee, that he taking out the mature oocyte, that is Graafian follicle, from the ovary, and how he will identify the mature oocyte, because it is difficult to, there are a lot of oocyte resides in this ovary.
Yes.
And what is his technique to find out the actual Graafian follicle, mature Graafian
so
follicle?
what is done, we give certain drugs and do ultrasound and find out that which is the maximum size of the follicle. So the one which is by cutoff is around 18 to 20 millimeter, and we try to retrieve the egg from there. So that is the mature follicle, we say. So that's how it is by ultrasound. It is identified.
More questions? But it was highly educational, educational lecture, and particularly for the women and those who have children, between 11 to 14, they should not ignore at all the pap smear stuff.
No, for young girls, it is vaccination, HPV vaccine, which is given free of cost now in the west of the world. But in India, few NGOs are arranging the 4 quadrivalent vaccine, which is cheaper. But because the 11 nanovalent, the 9 virus vaccine is quite expensive and can't be afforded by everybody. It's coming around 9 to 11,000 depending on the area.
Really?
Yes, but the quadrivalent is 2,000 rupees. So, but that's why we have an Indian company which is giving, Serum Institute, who have brought forward the COVID vaccine as well. So many NGOs are trying to vaccinate girls in the poor social slum areas to help out. But obviously the uptake rate is not that much as a polio or TB.
But government doesn't arrange for free pap smear? Free
pap smear is there in the government hospital.
Okay.
But uptake of going for the pap smear, you literally have to push the woman, make them understand that it is necessary, then most people will go.
Yeah. But that's very, very common. Everybody takes it in USA, I know. So that's a very important thing for the safeguard of the future health. So women must actually take the pap smear, as she said. It's a very, very important thing for their life.
It's same like checking your sugar levels. Everybody check their sugar levels now and then. Then why not pap smear every 3 years?
Thank you for the talk. I just want
Welcome.
to add one thing, that it's not only about the girls, it's also about the boys.
Yes.
So the boys should also take the vaccine, to
absolutely.
protect themselves for certain other cancers, and also protect their spouse, the would-be spouse, from these things. So the boys should also get the vaccination, the same vaccination.
I haven't heard about that boys taking, but
yes, it's for boys also. The penile cancer can be prevented with vaccination. The age group is same.
Okay.
So, but the boys can't take beyond 15 years of age. Still now it hasn't been proven that beyond 15 years they get benefit. So the boys, the age restriction is there, but for women there is no age restriction so far. But it works best if you take before 26 years of age, because the immunity from the vaccine developed best before 26 years of age.
Okay, so it's a very important information that she gave for all of us actually. If you know anybody, any young people like that, you should encourage them to go and take it, even at the government hospital if possible. Okay.
So if vaccine is even not affordable by people, they should go for the pap smear because it is freely available in government sector.
Yeah. So any more questions, please? Okay, no more questions, so we can give a really thanks.
Thank you very much. Thank you.